All right, let's talk about something really important. How you can start buprenorphine treatment for opioid use disorder right from the comfort and privacy of your own home. Think of this as your personal, step-by-step guide to taking back control.
You know, the road to recovery can feel, well, it can feel like a long and lonely path. But you're not walking it by yourself. Buprenorphine is a really powerful tool that can help, and we're going to use this explainer as your map for those first critical couple of days. So let's see where we're headed. We're going to break this all down into 4 simple parts. First, we'll get to know the tool itself. Then, we'll cover how you get ready for that first dose. After that, we'll walk through the whole process, day by day. And finally, we'll have a real talk about the risks, the amazing rewards, and what comes next.
Okay, so first things first. Before you start using any tool, you've got to understand how it works, right? So what exactly is buprenorphine?
So, buprenorphine is what's called a partial opioid agonist. Let's just make that simple. Think of opioid receptors in your brain like little locks. Opioids are the keys. Now, buprenorphine is like this special key that fits into the lock perfectly, and it holds on tight, blocking any other keys from getting in. But here's the trick. It only turns the lock part way. And that's the magic. It's just enough to stop cravings and withdrawal, but not enough to give you that same intense high. Your whole treatment journey, what's often called medication-assisted treatment, or MAT, it really happens in 3 stages. You've got induction, stabilization, and maintenance. Now for this explainer, we are laser-focused on that very first, super important phase, induction. This is all about safely getting the medication started in your system over the first day or 2. Okay, we're moving on to preparation, and honestly, this might be the most important part of the entire process. Getting these next few things right is absolutely what sets you up for success. So you have a choice here. You can start this at home, or you can do it at your doctor's office. Doing it at home is, more comfortable. It's private. You don't have to go anywhere. The challenge, though, is that you're the one managing that tough waiting period, and your care team isn't right there with you. This is a really important conversation to have with your provider so you can figure out what feels best for you.
Now listen up, because this is absolutely critical. You have to stop taking other opioids for a specific amount of time before you take that first dose of buprenorphine. For short-acting stuff like heroin, you gotta wait 12 to 24 hours. For longer-acting ones like Oxycontin, it's more like 36 hours. And for methadone, you might be looking at 48 hours or even longer. The single most important thing you can do is be 100% honest with your care team about when you last used. This waiting period is non-negotiable if you want to avoid a really bad time.
Okay, so you've waited. You've done the hard part. But how do you actually know in your body that this is the right moment to take that first dose?
You need to be in what's called moderate withdrawal. In plain English, you need to feel pretty sick, kind of like you have a really bad flu. Your care team's going to give you a checklist. You're looking for things like feeling restless, getting chills, your joints aching, a runny nose. Don't worry about trying to read that clinical form on the right. That's the fancy COWS scale your doctor uses. The goal is just to make sure you're feeling sick enough for the medicine to help, not hurt. If you've got at least 3 of those flu-like symptoms, that's usually the green light.
All right, you've done the prep work. You're in withdrawal. You are ready. Let's walk through exactly what you need to do day by day.
Day 1. It's time to take your first dose. The most important instruction is right here. You have to place the film or the tablet under your tongue. I'm going to say that again, under your tongue. Buprenorphine just doesn't work if you swallow it. It has to dissolve and be absorbed directly. So let it dissolve all the way without talking or drinking anything.
Now, your provider is going to give you a very specific dose, but just so you have an idea, a very typical starting dose is 4 milligrams. That might be half of an 8 milligram tablet or a single 4 milligram film.
After that first dose is totally dissolved, you do one simple thing. You wait. Seriously, just set a timer for 1 hour and pay attention to how you feel.
Okay, the hour is up. Now you've got a decision to make. If you feel okay, maybe even a little better, great, you're done for the day. That's it. If you're still feeling significant withdrawal, you can take a second 4 milligram dose. But, and this is the big one, if you feel worse than when you started, stop what you're doing and call your provider right away. Whatever happens, make sure you check in with your care team just like you planned.
And just like that, you've made it through the hardest part. You are through day 1. Seriously, take a second and let that sink in. You are doing a great job.
So the goal for day 2 is all about finding your stable dose. You're going to start by taking the total amount you took on day 1, all at once in the morning. So if you took 8 milligrams total yesterday, you'll take a single 8 milligram dose this morning. Then you just see how you feel. If those withdrawal symptoms start to creep back in later, you might take another small dose. The key here is just to stay in close contact with your provider to get that maintenance dose just right for you.
Now that you have the playbook, let's zoom out and look at the bigger picture. We have to be honest about the main risk here, but more importantly, we have to talk about the incredible, life-saving rewards that make this whole thing so worth it.
So that big risk we've been trying to avoid is called precipitated withdrawal. Remember how we said buprenorphine binds to those receptors really tightly? Well, if you take it too soon while other opioids are still hanging out in those receptors, the buprenorphine comes in and aggressively kicks them all out. That sudden eviction is what causes a really intense, really fast wave of withdrawal symptoms, and that is why waiting is so important.
So what if it happens? First thing, don't panic. Call your provider immediately. Now, this is going to sound strange, but the most common way to fix it is actually by taking more buprenorphine. The idea is to flood your system with enough of it to finally calm those receptors down. It's totally manageable, but you need your care team to guide you through it.
And now for the reward. Why do all this? Because it works. It really works. This data from a huge study it's incredible. Look at these numbers. For people who stayed on treatment for at least 15 months, the risk of an overdose event dropped by a massive 173% compared to those who stopped early. Opioid-related hospital trips, down 128%. The message here couldn't be clearer. Staying on treatment saves lives, period.
And the best news of all, it is getting easier and easier to get this medication. A new law, the MAT Act, got rid of an old, outdated requirement called the X waiver. This basically means that pretty much any provider who can prescribe medication can now prescribe buprenorphine, opening up access to this life-saving treatment for so many more people.
So, you have the map, you have the guide for the first few steps, the knowledge is officially in your hands. Your road to recovery is waiting for you. The only question left is, are you ready to take that first step?